Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Let's talk about some science today. I want to focus in on NAC. This is one of those supplements that I find myself speaking with people about for so many different utilizations when it comes to overall health benefits. And it's interesting because usually when I say NAC, people say, what in the world is NAC? So I thought, let me kind of just give you a brief overview of what exactly NAC is and all of the different clinical ways in which NAC has been studied and is currently being studied. Right now, NAC is being studied for COVID-19. And so I want to talk about that briefly. These are brand new clinical trials that have just been approved where they are utilizing NAC. So I want to talk about all of those things for you today. Now, my name is Amanda Williams. I am an MD, MPH, and I am super excited to break down NAC for you so that you understand why N-acetylcysteine is so incredibly advantageous when it comes to our overall health. So what NAC actually is, it's this modified version of the amino acid cysteine. And when we take it internally, NAC helps to replenish intracellular levels of one of our most powerful antioxidants, which is glutathione. So by helping to restore glutathione levels and elevate those levels up, this allows the cells the ability to fend off oxidative stress and free radicals, which is always a good thing because we know that we're exposed to so many different free radicals throughout the day. So these are free radicals that can be driven up internally as well as all of the external sources. But when most people hear of NAC, they usually think of liver health, and that makes sense because we know glutathione plays a essential and critical role in terms of being able to help those little hepatocytes, those are your liver cells, to fend off all of the different toxins that we are exposed to. Remember, your liver, that's the main organ in which detoxification occurs. So NAC is very beneficial when it comes to enhancing the body's ability to really prevent a lot of the issues that can come up when we look at toxic overload. NAC is so important that if someone takes too many acetaminophen, which is Tylenol, and they end up in the emergency room, they give them IV NAC. Well, why in the world would you show up to the emergency room and they're trying to save your liver because you're in acute liver failure? Why would they give people NAC? Well, the reason why they are pumping you with IV NAC is to try to save your liver, try to really boost up the glutathione production to be able to repair those tiny hepatocytes that have just been bombarded by a toxic dose of acetaminophen. So that takes me to the interesting topic of when we think about NAC, and say if you were to ask the average physician, and you said, well, what do you think about NAC? Most doctors would probably look at you and say, I have no idea what you're even talking about. But if you put it to them in the setting of a board examination question, then they would know. If you said, okay, a patient presents to an emergency room, had a toxic dose of acetaminophen, what is the primary treatment? What are you going to do? And guarantee you, almost all physicians are going to know that answer, and they're going to say, well, you have to give them N-acetylcysteine. You got to pump them with N-acetylcysteine. But then they're dismissive to understanding why it is that NAC is just so important, and even understanding that pathway for the glutathione production. So it's interesting because I've talked to so many people throughout the years who have a variety of different health conditions where it would be so incredibly advantageous for their doctor to tell them, hey, you need to be on NAC. I mean, there's even prescription NAC. So people who have idiopathic lung disease, oftentimes their doctors will prescribe them high-dose NAC to maintain lung function. So NAC is utilized so much in the human body, but yet so misunderstood, and to the common physician is really overlooked. So let's talk about some of the other ways in which NAC can be utilized. So we know, obviously, the glutathione aspect, which is great in and of itself. So say if you were utilizing NAC, N-acetylcysteine, because you want to bolster up your body's endogenous antioxidant, glutathione, then that's great. But people oftentimes are unaware of the fact that NAC actually can inhibit the expression of pro-inflammatory cytokines. So say if we have exposure to different bacterial infections, if we have exposure to different viral infections such as influenza, these viruses that cause upper respiratory infections, NAC can actually inhibit the expression of those cytokines. So during this COVID pandemic, people have probably heard the word cytokine storm. And this is when the immune system just goes out of whack, basically. And you get this really big surge of all of these inflammatory cytokines, and the body cannot handle that. And this is a very dangerous situation. Well, what we know is NAC can try to suppress that. Hence, that takes me to this brand new clinical trial that is just starting. Now, is this a clinical trial that is being done, in a place that no one has heard of? No. This is sponsored by Memorial Sloan Kettering Cancer Center. And what their thought is here is that they say the medication, NAC, N-acetylcysteine, can help fight COVID-19 virus by boosting a type of cell in your immune system that attacks infections, and by helping the immune system fight off that virus. So the researchers are really thinking that if they give people high-dose IV NAC when they are in critical care units, so in the ICU, that this can really allow the patient to be moved out of the critical care unit or go off of a ventilator. I mean, this is amazing stuff. Memorial Sloan Kettering, and this is a study that is currently going on, an active study. So this is really, really key. And there was a research report that came out back in April in the Journal of Medical Hypotheses, where they were talking about this. They were saying, hey, N-acetylcysteine, this may actually prevent COVID-19 associated cytokine storm and the acute respiratory distress syndrome. So you think about all of these different cytokines that are released, and we look at the different interleukins, and we look at tumor necrosis factor alpha, all of these major things, NF-kappa beta, for example, we know that's a major driver for inflammation. So if we have all of these things that are activated because the body's going, oh my gosh, we're under attack, but then we get this increase in the cytokine storm, then this is a major, major issue. And so the people who have been falling severe victim to COVID-19, we know it's coming down to that cytokine storm and that acute respiratory distress syndrome. So really interesting. And I will be keeping an eye on this because I am a fan of scientific research. And when you have an institution that is so well renowned, such as Memorial Sloan Kettering, that's saying, hey, you guys, you know that stuff that we use when people take too many acetaminophen and we do it to save their lives from liver failure? We think that this may be beneficial for COVID-19 patients. And you have to be aware of these things because COVID-19 is not somehow going away. It's not going away tomorrow. It's not going away in a month. So the fact that there is research out there utilizing an amino acid to be beneficial is just phenomenal. Now, we already know that NAC has been shown to be able to fight off the stomach infection that is brought on by Helicobacter pylori, so H. pylori. That's the most common bacterial infection in the stomach that is directly causative to peptic and duodenal ulcers. So when we look at stomach ulcers, you have to look at H. pylori. Well, they know that NAC can help to fight off the H. pylori, and it's doing it on two different fronts. One is it's inhibiting the growth of H. pylori by reducing the production of the inflammatory cytokines. We go back to that. And this is, really essential that we focus in on. NAC is not just about the manufacturing of glutathione. That in and of itself is wonderful. But the fact that we know that this modified amino acid actually is doing all of these things within the immune system, within the inflammatory response, is absolutely remarkable. The fact that it can suppress that master signaling molecule, NF-kappa beta, which is nuclear factor kappa beta, the fact that it can downregulate that to limit inflammation is really, really impressive. So we know all of these different things. We know that NAC has been shown even in the setting of diabetics and people who have significant metabolic disorders, that NAC helps to improve upon insulin sensitivity. That is astonishing. You think about that just for a moment. Who would think that this little tiny capsule of this amino acid can do so much? It goes so far beyond that of just the detoxification process, which is absolutely a wonderful thing. They've even studied NAC in the setting of exercise-induced muscle damage and oxidative stress. So there are many people who say, maybe taking NAC for working out would be beneficial. And that makes sense because once again, we have to think about what happens with internally produced free radicals. So if we are working out, we oftentimes will build up these free radicals. We build up lactic acid, which can be damaging at a cellular level. So NAC can be advantageous for this. Now, back in 2016, the European Society of Cardiology, they did this really wonderful study, and it was called the NAC-IAM study. And what that stood for was N-acetylcysteine in acute myocardial infarction. So we are talking about heart attacks. And they did this placebo-controlled double-blind trial. And what they wanted to determine was that if they gave patients who just had a heart attack, if they gave them IV NAC, would this do anything in terms of reducing the infarct size within the heart? So when we talk about an infarct, what we're saying is when someone has a heart attack, what happens to the muscle? The heart itself is a muscle. So when we look at that heart muscle, there is an area that can get starved out of its ability to properly function. So it's infarcted. So it means it's lost its proper blood flow. It's lost its proper oxygenation. So that area of the heart basically is dead now. So they said, well, what if in the midst of someone having a heart attack and they're, admitted into the hospital, what if we give them NAC? What would actually happen? Well, in this particular study, they found, and the way that they were able to do this is they did this really detailed imaging called cardiac magnetic resonance. So it's basically doing an MRI looking specifically at the heart. So it's very, very detailed. And they were able to do this within 1 week of people having a heart attack, and then they followed up again 3 months later. Now remember, in this study, this is a double-blind placebo-controlled trial. So half of the people who had the heart attacks and survived were given NAC via IV. The other half of the people were given a placebo. And what they determined was that the intravenous NAC administration was associated with a more rapid resolution in chest pain. So the people that were saying, oh my gosh, I have all this angina, I have all this pain in the chest. So that went away faster. They had improved myocardial function. And they also found that post heart attack, that the infarct size, the area of the heart that was actually dead, was shrinking. Absolutely amazing. And I think that this is one of those things that when we talk about a basic amino acid, we don't recognize all of the many benefits. NAC has been utilized in the world of psychiatric medicine for a very long time in the setting of post-traumatic stress disorder, in obsessive compulsive disorder, in anxiety, in depression. Because when we look at the lack of antioxidants to fend off free radicals, when we look at an overabundance of inflammation in the body that can all exacerbate these conditions, they have found that NAC is very, very beneficial. they did a study out of the Medical University of South Carolina where they took a group of veterans who had PTSD, and you can only imagine some of the things that they were exposed to and why they would have PTSD. And they found that the veterans that they gave N-acetylcysteine to, compared to placebo, had a significant improvement in PTSD symptoms, as well as their mood. So for a lot of these veterans, they were complaining of significant depression. They found that depressive levels went down. So that's one area in which it's been looked at. It's also been looked at, as I mentioned, in obsessive compulsive disorder, which can be incredibly debilitating to someone who is suffering from that. Stanford University, as a matter of fact, they came out with some really interesting research about a decade ago now, and that was looking at the utilization of NAC in children who had autism, and looking at how many of the children with autism had these repetitive behaviors when we talk about OCD. And they said the irritability in many of these children was really quite significant. They said irritability affects approximately 70% of children with autism. And we're not talking about mild things. We're talking about really acting out. So they did this study, and to their surprise, they found that NAC was a really good option for these children when it came to dealing with this secondary symptom that goes along with autism. So there are so many different clinical research studies. Generally speaking, when I am talking to folks about utilizing NAC, it's usually in the setting of respiratory function. So for those who are dealing with, any type of respiratory distress, whether they've been diagnosed by their physician with some type of pulmonary fibrosis or COPD, for example, which is chronic obstructive pulmonary disorder. In those types of settings, what we have found through clinical research is that the NAC helps by not only enhancing antioxidant levels to fend off the reactive oxygen species, but also it helps in terms of thinning out the mucous membranes, which is really important for people who deal with these different types of respiratory disorders. So there's so many different bits of research when it comes to COPD, when it comes to asthma, when you look at all of the different respiratory induced issues out there, when you look at problems with viral based respiratory distress, so in the setting of pneumonias and influenza, for example. And that's why I think that the research right now at Memorial Sloan Kettering is so remarkable, that they are utilizing NAC in the setting of COVID-19 patients, which is not surprising to me, because what I know about NAC and the power of NAC, the fact that it can downregulate inflammation, the fact that it can stop the body from creating this cytokine storm, the fact that it can thin out mucous membranes to help for clearer respiratory function. So while many people may kind of dismiss or overlook something as wonderful as NAC, and for traditional doctors who say, that's just for someone who took too many acetaminophen. No, we know what NAC can do. We know the benefits when it comes to heart health. We know the benefits when it comes to brain health. That's why it's been studied even in the setting of neurological disorders such as Parkinson's disease. So many different functions for NAC that I find it advantageous for anyone to be considering a powerful antioxidant. So it's always best to, make sure that you're speaking to a health professional when it comes to adding any type of nutrient to your supplementation routine, to make sure that you're taking the right amount at the right time, taking it with food, without food. There's all these different caveats that go along with this. With NAC, you always want to take that one with food. But it's just such a powerful nutrient, and I think it's so overlooked and underestimated. So I will be keeping my eyes on the outcome of the study coming out of Memorial Sloan Kettering. I do expect that should wrap up probably within the year. I know that they are estimating that one to go into 2021. So I'll keep an eye on that, because I will be waiting to see what I believe will be very positive benefits from the addition of the IV NAC for COVID-19 patients. So a lot of different ways in which NAC can be utilized. You can check out our website, invitehealth.com, and you can see NAC listed, and you can find other scientific research on NAC. It's very well studied and so many different utilizations. Like I mentioned, it's used as a prescription medication in many people who have respiratory disorders. So this is just a wonderful, wonderful nutrient. So that is all that I have for you for today. I want to thank you for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure that you subscribe. You can leave us a review, and you can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.